for just one more word, and it's an important one. So if you have a moment and don't need to go anywhere, I want to introduce Rafe Squitieri, Dr. Rafe Squitieri, who, as we mentioned, is the soon-to-be chairman of the Cardiovascular Services and chief of cardiothoracic surgery at St. Vincent's Medical Center. Dr. Squitieri, please take the stage. Thank you, and give him a warm welcome.
Thank you, sir. Thank you very much. It's an honor to be here, and thank you all for coming. I would like to just continue with thanking the Mitchells and the Mitchell family for hosting this very generous event. We couldn't do it without you, and again, thank you so very much. I also wanted to recognize Kim Pugh for all of her hard work. She has worked tirelessly, many, many hours to put this together and made it happen. Kim, thank you again. Thank you so much. I would like to thank Dr. Anya Wagner as our spokesperson for Women at Heart. She does a terrific job. Anya, thank you very much. I'd like to thank all of the models. They did a great job, and all the stylists for all their hard work, and all the staff here at Mitchell's. I'd like to really thank all the sponsors, the special sponsors that made this evening possible, and all the guests. Thank you for coming. I know it's getting a little bit late, and I don't want to take too much time. And when Kim asked me to do this, she said, "Can you say a few words about cardiology?" And I always get very excited when I get an opportunity to talk about our department, cardiovascular medicine, and all the talented and dedicated people that we have working at St. Vincent's to make all of these great things happen. And then she said, "You have 5 minutes." So I'm going to try and move pretty quickly through this. I wanted to mention one thing, and you can jump ahead a couple of slides for me. One more. That we have just kicked off our cardiovascular campaign, and this is a very important initiative for us at St. Vincent's. It's a campaign just for cardiology, and it's focusing on 2 areas. You can go ahead for me to the next slide. The first is to build a brand new electrophysiology lab, an EP lab. Yes. This is about a $4 million project, and it's really going to be a state-of-the-art lab, and it's going to allow our EP physicians to take our complex arrhythmia center to the next level. Already, that group that runs our AFib center has some of the best results in the country with respect to AFib outcomes. And this will allow them to improve upon those results and also increase patient safety and satisfaction at the same time. And that is really, really a big need for us at St. Vincent's to have this opportunity to do this and to build this lab. The other part of the capital campaign for cardiology is to renovate the 6th floor. Can you advance? This, if anybody's been there recently, you'll know that it's in desperate need of renovation. And I think it's overdue, and I think it's going to be a major, major component of our success going forward. It'll allow our patients an environment to recover from whatever they've had, in really an environment that's on par with the quality of the care that the staff has delivered them, and it'll help them really recover much more quickly. And I think it's going to impact their overall experience terrifically. So that said, I'm going to just now leave, you can move to the next slide, just to share with you a few patient stories that have really, I thought would be nice to share with you all this evening. And you know, St. Vincent's and cardiology has had a lot of firsts. We've had a lot of firsts. We were the first to do TAVR in our region, the first to do PAMI in our region, and on and on. But I wanted to share with you two quick patient experiences that were recent firsts for us. Can you go to the next slide? So this picture here is a picture of our TAVR team, and that's the team that does the minimally invasive aortic valve replacement. We were the first hospital to do this in our region, and we kicked this program off 2 years ago on Valentine's Day. And since then, that team has performed hundreds of these procedures, and it's been incredibly successful, and we've helped many, many patients who really were too sick to have surgery. And you can see here, there's a balloon going in and replacing that aortic valve without surgery. Very recently, we had an elderly gentleman come to the hospital with very severe mitral disease of his mitral valve. And he was dying in heart failure, and he was seen by the heart valve team, and it was clear he was too sick to have any kind of an operation. At most hospitals, someone like this would likely be just sent home, made comfortable, and that would be the end of it. But our TAVR team, headed by Dr. Jumper and all of our staff, decided to try and do something for this gentleman. And they went to the IRB, which is our review board, and they petitioned to get use of this aortic valve for this gentleman in his mitral position. And after about 5 days of deliberation, the IRB came back and said, Dr. Jumper, you can do that procedure. So go to the next slide. This is a picture of that gentleman about a week after he had that life-saving mitral valve replacement. I would say probably fewer than 100 of these procedures have been done in the country, and this was the first one in our area. And I think it speaks volumes about the group of individuals, the physicians, their dedication to go to bat for just one single patient. And I couldn't be prouder to be part of that team. I have to mention Rodney Seaman. He's our TAVR coordinator. He does a phenomenal job. And the last patient story I want to share with you is really a moving story. It's a story of a young woman in her 30s. She was pregnant, and just recently she developed a terrible pneumonia. And she presented to the hospital really in extremis. I don't think she realized how sick she really was. So by the time she made it to St. Vincent's, she actually went into preterm labor and delivered at 30 weeks. She became so ill that she had to be placed onto a ventilator immediately after delivery. The baby went to the NICU, the mom went to the ICU, and I just remember seeing her husband in the waiting area, just thinking, what just happened? Within about 3 days, her lungs had completely failed, and she was really nearing the end of her rope. And the heart team was called to see her. It's a multidisciplinary team of cardiologists and nurses and specialists. And they made the decision to place her on ECMO, which is extracorporeal life support, to try and buy her some additional time so that her lungs might heal up and that she would have really an opportunity to survive. So in fact, she did get placed onto that machine. You can see kind of a schematic of what that looks like, and that allows a patient to have oxygen placed directly into their bloodstream when their lungs can't do it and their heart has failed. And go to the next slide for me. This is a picture recently of this. I think Stu Marcus said it best. When I showed him this picture, he said, you know, that smile, that's what it's all about. And I think he's right. I couldn't be prouder of the team and the people here in this room and the physicians because they make all of this possible. And with that, I'd just like to thank you all for being here this evening. I want to remind you to go to the Giving Tree and also to pick up your gift bags and some candy at the candy bar before you go. But again, this has been a great evening. And thank you for everything you do for St. Vincent's. Good night.
Thank you, Doctor. Thank you, everyone, for your generosity. It is my honor to be here again this year. And here's to great things in the next 12 months. Thank you for having me. Don't go anywhere. You don't have to rush out. Enjoy the evening, and thank you. God bless.